I appreciate the Pride Center for allowing us to use their center and their story for our announcement today, because what we seek to do is to ensure that every New Jerseyan's God-given abilities can be maximized. And so our legislation is meant to ensure that those who have had the ability and our society's investment in them doesn't end just simply because of a date on a calendar, and then turns what was until then the best day of their lives into the worst day of their lives in many cases. Last April, when National Autism Awareness Month was taking place, I made the point at that time, the time has come to turn autism awareness into autism action. Despite all that we've accomplished for people and families touched by autism, and we have made considerable progress together, it's simply not enough. There's more that we can do when it comes to those who age out of the services provided to them as children. We have to think about what happens next. What happens when a child who has been receiving services for many years turns 21? In our nation, there are roughly 50,000 children with autism spectrum disorder who reach adulthood every year. And they find themselves in a uniquely difficult position to continue their education or find employment. Currently, less than half of transitioning youth are participating in either secondary education or employment within the 2 years after leaving high school. And only 35% receive any additional education within 6 years. This lack of social integration and participation in the years immediately following high school sets transitioning youth on a path of non-participation that often remains for the rest of their lives. In order to ensure they have the opportunities to fulfill their potential and live happy, independent lives, we must provide the support and services they need to make that transition to adulthood a success. Here in New Jersey, where the rate of autism diagnosis is consistently among the highest in the nation, we are all too aware that we cannot afford to forsake the needs of all adults on the autism spectrum. The Centers for Disease Control and Prevention released data showing that what we knew was a high incidence of autism in New Jersey has increased substantially, whether that is by better diagnosis or whether it is simply a reality. Either way, with 1 in 49 children in our state being diagnosed by their 8th birthday, and for boys, a number staggering 1 in 29, this is particularly within a national context a largely driven New Jersey focus. While we must continue to meet the developmental needs of these children while they are young, we simply cannot dismiss them when they reach adulthood. It's not only inhumane, it's poor public policy, and it's time that we did something about it. That's why today, to help turn the tide of people on the autism spectrum aging out of the services they need, I'm announcing the introduction of the Age In Act of 2013, the Assistance in Gaining Experience, Independence, and Navigation Act. The Age In Act recognizes that in order to address the needs of young people on the autism spectrum transitioning into adulthood, the first thing we need to know is what are the most effective interventions, what support services are already available, and which among those are most effective, and what services and needs haven't been fulfilled yet. The first phase of the Age In Act provides the resources to find the answers to those questions and applies them then to develop a comprehensive training program. The second phase of the legislation puts that plan into action by providing federal resources to train a new generation of professionals to work with young people transitioning into adulthood. These transition navigators, as they are called in the legislation, will be trained to provide comprehensive services to address all the possible needs of transitioning youth. This includes providing access to continuing education, vocational education, and competitive employment. It also includes help in obtaining health care, housing, transportation, community integration, and other necessities. What we are ultimately trying to accomplish through the Age In Act is education in the true sense of the word, leading out of the best of the person's God-given abilities and potential to enable that person to lead the most independent and fulfilling life possible. I know we have many dedicated and caring professionals already working to help people transition into adulthood, but I want to take the opportunity to point out that Here in the Pride Center, we can see manifestations of what the Age in Act is all about. We were greeted by clients who prepared some fantastic refreshments. We'll have some of those to welcome us. The clients have a book club, but it doesn't necessarily meet here. They go to a nearby Starbucks or Panera Bread. They work as volunteers at the local Goodwill store. They shop at local malls as part of developing important life skills. For some, these experiences can lead them to the point where the Community Personnel Service office helps them get paid employment, a real job with real responsibilities. Pride Center is a launching pad for people on the autism spectrum to integrate with the society we all live in. And what we take for granted, for those of us who are not on the autism spectrum, is very significant life skills that can really provide for the fulfillment of an individual's adulthood. And the Age in Act will help develop a clearer path in what is largely uncharted territory to help youth on the autism spectrum transition into adulthood with the support they need to lead the most independent and fulfilling lives possible. I'm proud of the part that we've been able to play in Washington, proud to have included language in the Affordable Care Act to ensure that all qualified health plans provide the behavioral health services we all know that are so important. And as those plans become evident this fall on the exchanges that will be created, that's going to be, I think, a tremendous opportunity for families. It's now a critical component of the essential health benefits package, and one that I included because I heard far too many stories of families with a child with autism being denied critical therapies, being denied insurance because their company wouldn't cover them. I'm also proud to have overcome significant opposition in the Senate so Congress could send the Combating Autism Reauthorization Act to the President's desk. Legislation is critical in continuing autism research and services, but that 3-year reauthorization funding will end at the end of next year, so we'll be in the midst of looking for what I hope can be a longer-term reauthorization. And I hope to some degree, as I had desired to do it in the Reauthorization Act, where some of the aging out issues I envisioned and included services but couldn't get the majority of my colleagues to be supportive at that time, I hope we can include that too. So I'm looking for a longer reauthorization, and I'm looking to include some additional services. It's my hope that with the Age in Act, as well as with renewing the Combating Autism Reauthorization Act, that more members of Congress and more people in the United States understand that if we were to forsake the needs of people and families touched by autism, it would be at our own peril. The needs will not go away. The developmentally disabled will always be among us, and we have the chance to determine our future, instead of it determining us. As an American society that is inclusive of all people, that seeks the contributions of all people, including those with developmental disabilities and those living in the autism spectrum disorder. And I believe that all of you who have been advocates professionally or as organizations play a critical role in our engaging our fellow citizens, our colleagues, in a challenging time in Washington. I am not, myopic to understand the challenges of introducing a new program, but I am also very cognizant of the consequences of the numbers and not doing something. And that's what we have to educate our colleagues to.